Welcome to the Voice of Business, sponsored by the Greater Beverly Chamber of Commerce, which services Beverly, Danvers, Hamilton, and Wenham. This is John King, president of Headway Strategies. I'll be your host today, bringing you today's show. The purpose of the Voice of Business is to bring about people to come to talk to you about events, possibly different challenges that they're having in the business world, and to offer suggestions of how you might improve your business. Today, we're going to focus on a health insurance seminar that we did back in the early part of January. We conducted that at Ledgewood. They were a sponsor for us. And John Vigliotti is going to be here today. He's going to be talking about what we did on that particular seminar. And we'll start off by welcoming him. Thank you very much for coming today, John.
Thank you very much.
And why don't you give us a little bit of background of your background in insurance and in working with the state, some of the things you've done with the state.
So I'm an independent insurance broker. I've been in the business for about 36 years. I started my career with John Hancock, specializing in life insurance, disability, health insurance, long-term care. And I've been able to work with several chambers of commerce throughout Massachusetts, where I help them and I help their membership provide information on health insurance for like their groups, their businesses, Blue Cross, Tufts, Harvard, Fallon, Neighborhood Health, to name a few.
Okay. And you also did some work. We talked before about the work that you've done with the State Insurance Commission when Romney Care was first coming in, I think.
Well, going back when our state first started to set up the insurance exchange, the connector, I was one of the two brokers they brought in as a person to consult and to understand what the small business owner is looking for.
How was that process?
Well, the process was fine at the beginning, even though it was with the state. Everything worked smoothly, and then they had to put it together. We just gave them, the pros and cons on working with the small businessman, what they're looking for, why they're paying so much, and then from there they developed their own plan, their own program, which now actually became known as Obamacare.
Yep. Okay. What about changes? I mean, we've seen the health insurance change significantly over the last decade or so. What are some of the changes that happened that people are going to be affected by from last year that kind of came down?
Well, that's an interesting question. And what has happened over the past, say 3 years, it took about 3 years for Obamacare to be fully implemented. It was like certain phase that got phased in, but it's completely in our system right now. When people get their renewals for April 1st, that's when like approximately 95% of the businesses in Massachusetts are small business owners. They will be getting their renewal starting for April. They'll be getting it at the end of next week, the last week in February, very first beginning of March, they'll be getting their April renewal. Along with an increase in premium, I'm guessing, there'll also be changes in the plan design.
Okay.
So what does that mean? So we all know that we have deductibles, we have co-pays, and we have sometimes co-insurance. But on the new plan designs that the insurance companies are going to be introducing, there's going to be what is called hospital choice. And to make a long, complicated answer to this, it's basically they're going to try to steer people to where you're going to be getting a lower copay or a lower deductible versus a higher copay or higher deductible.
So if I went to a local hospital, to Beverly Hospital, which is now part of Leahy right now, versus Mass General, which is downtown, obviously, I would end up having a different tier?
Good example. So, for example, if you still would have the choice to go to the Mass General, Brigham and Women's, the higher-end hospitals.
Sure.
But you will pay, not an additional, but you will pay your normal deductible and probably a higher copay versus if you went to the local hospital, say the Beverly hospitals, you'll pay a smaller deductible with a smaller copay.
Okay.
So that's called hospital choice. Everyone should be looking for those options in their renewals, because if you choose the hospital choice plan where you're dealing with local hospitals, and that's your first choice, your premiums can be slightly reduced, ballpark like 5 or 6% the norm.
Okay, but I still have the ability to go to a more expensive hospital.
Correct.
But I would have to pay a higher premium, higher copay, and and the like.
Higher copay, higher deductible, a little bit more out of pocket, but the good thing is that you still have the freedom and the choice to go to that hospital.
Okay. All right. All
One
right.
of the one of the most important things on these new plan designs, like anything else, is the relationship with your doctor. That's key. You don't really have to or want to change your doctor, and you don't have to at all, but that's the most important thing, that your doctor accepts the plan, and then from there you can go to the hospital choice that you decide.
Right. I know when I joined another company a number of years ago, I reviewed their physicians that were in their plan.
Physicians are first.
And I looked at that, and the endocrinologist my younger son was using was not on that list. So we stayed with where we were under my wife's plan, because that made more sense, and it gave us some flexibility that we wouldn't have normally had.
Correct. If you have a relationship with your doctor and it's working out really well, that's a tremendous bonus in your family's portfolio. Absolutely.
Right. Right. Okay. Any more on that?
Yeah,
That's
so
pretty...
what people should be looking for in the new plans designs is what they've done is they've tiered prescription drugs. In the old days, we used to go to get a prescription, it would be like $5 for generic, $10 for brand name drugs. So let's call that 2 tiers. When people start getting their new premiums in their new open enrollment for April 1st, they're going to be noticing that prescription drugs now have 6 tiers. So that's 6 different ways that you'll be paying for your prescriptions. Depending on what your prescription is, it has a tier number on it on how much it's going to cost you. And they're going to range from a low of $5, like always, all the way up to like $175 for one prescription.
But do I have control of that as a
You will
user?
have control with that, as long as you have a great relationship with your doctor and you talk about your prescription and you ask him, what are my options? Because they should be aware of all the tiering now of prescriptions. So
Okay.
you're going to be able to use the generic or the brand name depending on what's right for you. But just be aware, there's a lot more options in turning points in just a simple little prescription. There's about 6 tiers for each company now.
That's going to take some getting used to.
That's a big change.
Yeah, yeah.
So when somebody went to the prescription a couple of months ago and got a prescription, if you have a similar plan or the same exact plan, there is a chance that you might not be paying that same amount from April 1st going on.
Okay. So it's going to be important for everybody to take a look at their policies when they come out and understand what it is that they're...
Most policies have changed slightly because of the Affordable Care Act,
Yep.
Obamacare, fully implemented for April 1st. That will have a significant change on your hospital choices and your prescription.
And your drug choices.
Yep, and inside that, there'll be copays. So you want to be sure that you look closely at your prescriptions, because there could be a deductible or even a copay on prescriptions now, along with the tiering. And then even with the hospital choice, depending on which one you choose, there will either be a higher deductible or a lower deductible, higher copay, lower copay, depending on the hospital you choose.
Okay. So we need to make sure we think about that when we're working with it. But I think it really gets back to really making sure you have that conversation with your doctor.
You want to definitely have the conversation with your doctor to see that he will still remain as your primary care physician, right, and that the particular prescription drugs that you are taking didn't get erroneously escalated in price. It stayed within a certain price range that's affordable.
Sure.
Or ask him, what is the option? What is
Okay.
the generic?
Okay.
Some people can't take generics. They have to go brand names, and let them talk it out with their doctors.
All right. Okay. Let's talk a little bit about when to apply for Medicare, because that's something that's passed for the most part for the year. But in preparation for those people that are turning 65 this year, what should they be doing?
Well, it's important. It's an important question. We believe from the studies that we found, people will probably get the best service if you go to the facility, the
Social Security,
yeah, office, 3 months prior to you turning 65.
Okay.
So that's when you can go in there. You can actually have an excellent conversation with the service people, and they will guide you on what's the best fit for you when you are ready. So sometimes people are still working part-time, they're working full-time, they're not sure. But if you physically go to their office, you'll be able to talk to one of their professionals, and get all the detailed information that's really going to be important for the next couple of years.
So what if you decide to stay on your current plan at 65? Can you do that?
Well, if you're working full-time,
Okay.
you should have the option based on your employer's guidelines, whether or not you could stay full-time on the full-time plus have a full-time plan that's offered to the rest of the employees,
Right.
or there might be a company policy where it's time to move off to Medicare, and you will be eligible if you go apply 3 months prior to turning to 65. You'll at least want to sign up for Part A.
Okay.
The other parts will be explained to you. You can either get them through the current plan that you already have, or right at the Social Security office.
Okay. Very good. And we have a number on the screen here that will tell them how to contact Social Security.
Awesome.
If they want to do that. And I think it's good. I don't want to tell you my age, but I did go through that some time ago, and I did find that it was helpful to do it in advance to make sure you knew what you were doing.
And I believe you should do it in person. There's a lot of things we can research on the internet nowadays and even on the phone, but this is insurance. It's a little bit harder to follow. I think it's better if somebody physically went to the office, spend a half an hour. You'll come out of there with a lot of knowledge and very comfortable. You will feel as far as being confident to make the right choice.
Yeah, yeah. I think that's good. I mean, nothing wrong with doing some research beforehand, but going in and getting the actual...
No, you want to sit down with the professional so they can go over the details and explain your situation so that it's the right fit, because not everyone's different.
Yeah. So what are some of the more popular plans on the market today?
Well, here's how it's working. Unfortunately, say 10 years, 15 years ago, there were plans that people really enjoyed where there was no deductible or very little deductible. Well, things have changed drastically in order to keep the rates down. So most of the plans have a deductible ranging from $1,000 to $2,000. Okay, those are the most popular plans. From there, they basically have an emergency room service charge, which is anywhere between $100 and $250. Then there's going to be a separate inpatient deductible, a separate outpatient deductible, and then comes along your prescriptions that are tiered.
Right.
So it's almost like walking on a minefield depending on which one you pick. If you pick the plans that have the lower deductibles, because there's probably a $500 deductible out there, it's hard to find no deductible. But the $500 deductible is going to come with a higher premium than a $2,000 deductible plan.
Right.
They're also offering that you can have, so if you have at least 1 or 2 or 5 employees, you will probably be able to have 2 or 3 different plans under one company. So because one plan don't fit all, the insurance companies are being a little bit flexible, saying, Blue Cross will say, okay, you can have 2 different Blue Cross plans in there. Neighborhood Health might say you can have 2 or 3 different plans under a 5-person group.
Yeah,
That's sort of new this year with all the carriers.
Right,
Some of them had it, but now all of them have it.
Right. My son works where he is working. They only have a family plan. They do not have a 1+ plan. So if he goes to a 1+, he could in theory save some money as opposed to a family plan, but they haven't brought that as an option for him.
Well, then your son must work for a large company, over 100 employees, or is he in Massachusetts?
He's in Massachusetts, yeah.
How many employees with that company?
It's a
Over 100?
It's a municipality.
Yeah. So, for example, group sizes, I know for sure, say 20 and under, have to have a single rate, a husband and wife rate, a mom or dad with 1 child, and a family. That's 4 tiers on the rates. That's how it is.
Wow.
That's how it is. So everyone will be seeing a 4-tier rating system across the board.
Is that...
Well, group sizes say 20, 15, 10 and under.
Okay. But the larger organizations
The larger,
don't have to do
anything over
that.
100, they're still in that nowhere land where that they can kind of custom fit the plan to them.
Okay. All right. So what is it? We talked about a platinum plan at one point. Does that still exist under
Not really. No, those were the old days with the connector and.
Okay.
But what a platinum plan meant is that you have the very best plan that the connector they can offer. Okay, meaning that you'd have a very low deductible.
Right.
Then the silver was available, and they still might be available out there through the connector. And the silver might be having, like I say, a $1,000 deductible, where the bronze would carry the $2,000 deductible. So that's how they were broken up, the platinum, the gold, and the silver, and the
Right.
bronze. They're broken up based on your out-of-pocket in the amount of the premium. So the higher premiums would be the platinum and the gold. The lower premiums with the higher co-pays would be the bronze.
Okay. And so what about catastrophic plans?
Well, that's a good question. So catastrophic plans, they really don't exist like the older days, like 20 years ago, where that we could choose a $5,000 or a $3,000 deductible. We could have co-insurance, and they would just be designed that, God forbid, something serious happened, you could go in and get your services treated, you'd have an out-of-pocket. Those plans were very popular, but the state will not let the insurance companies offer those anymore. And so now we just have the highest deductible outside of an HSA a health service.
Health services account?
Yes, the health services account. Outside of those, you can get a higher deductible. So the highest deductible you can get without any health service accounts on them is $2,000. So to answer your question, the highest deductible, so a catastrophic plan with a $2,000 deductible is really not catastrophic.
Yeah.
It's full major medical.
Right.
You just have a deductible of $2,000.
Right.
With the service accounts, you can get a $3,000 or a $5,000 deductible, but you'd have to have those are separate plans outside the norm.
Okay. I
They're
mean,
available.
I remember the catastrophic plans because
They're very popular.
We did that way back,
It saved people lots of money.
and we ended up not taking it after a period of time. But anyhow, so that was it. Interesting. So let's talk about the Cadillac tax, and as we talked before we got on the air here, it's something that affected me because my wife's company had good insurance, very nice insurance policy, and then they ended up scaling it back because they didn't want it to get into the Cadillac rate. So tell me a little bit about the Cadillac tax is.
All right. Well, this was the idea of Senator Kerry, and he thought it would be a good idea that you're a great example, that if you had a policy where that, I believe the number is $25,000 in premium. So if you pay $25,000 in premium, anything over $25,000, you were subject to a tax, and they coined it the Cadillac tax. So the reason why you had such a good plan, I'm going to assume because you had a very low deductible. Like we talked before,
right.
the lower the deductible, the higher the premium. Well, the Cadillac tax penalized people that had a real good plan, had a very good plan, and that the premiums went over $25,000, they got hit with a separate tax.
Yeah, we did not get hit with a tax as such, but we did have a restructuring in the plan.
Well, you restructured before the tax
did that.
hit.
Yeah, they did that.
So that would have affected you. It was going to affect a lot of people. And at the last minute, I think the unions got waived from the Cadillac tax, and I know it affected some people for sure.
Yeah, no, it was just crazy the way it all came down. Let's talk a little bit about the difference between HMOs and PPOs.
All right. That's a good question. So, and sometimes we can have a combination of both inside of a company. An HMO is what we traditionally have in Massachusetts, say for the last 10 years, health maintenance organizations, where that you have to have a primary care physician out of the book, and he's your first line of care. You have to go to your primary physician first, and then from there he will direct you to the specialist or hospital, whatever needs to be done from there. But you must maintain the relationship with your primary care physician first. That's how the claims get paid on the HMO. With the PPO, you will have the option to choose not only your primary care, but if you choose to go to another doctor, you can, and you don't need any permission, you don't need any clearance, you just make the appointment, you can go. There's the flexibility of picking and choosing the doctor of your choice depending on what the service is, okay? Usually, the PPO is a little bit more money, okay, like say 10 to 15% more, but they're very good when it comes to employers that have employees that are not in the state of Massachusetts. So if you had a couple of people in Rhode Island, a couple of people up in New Hampshire, and you had 10 people in Massachusetts, the people outside of Massachusetts would have the PPO because they can choose the doctor of their choice, because it's hard for them to have a primary care physician in Massachusetts. And the others rest of the employees could have the HMO and save a little bit of money.
Yeah, it's funny you say that because my older son works in Massachusetts and lives in New Hampshire.
Okay.
And so if there was a period of time he could not go to a doctor in New Hampshire, he had to go to his primary care physician in Massachusetts.
Correct.
And that went on for a while. Then they eventually changed it, but
Right.
that was a restriction. So wherever he did, he had to drive 40 miles over here to get to where he was going to get
So
to.
most of the companies are expanding their doctor list, and what's going to happen is that they're either going to put it under the PPO umbrella where the doctor's still part of the network, but it's not a primary.
Right.
Or, like on Southern New Hampshire, a lot of the carriers still use that as a primary care doctor, and they're part of the network under the HMO because
Okay.
it's expanding.
Okay, great. So let's talk a little bit about how you prepare for renewal, and what do you want to look at in that case?
Well, that's a good question. This renewal is going to be slightly different than most. There are new plan designs because of the Affordable Care Act, the new law. First off, that based on all the experts giving the best information on how to prepare, number one is they're saying is to have a very, very strong relationship with your doctor, your PCP. You want to make sure that you're able to pick up the phone, call them, have a relationship where that you can discuss what's wrong, what are the options, and the stronger that relationship is, they're saying that's the first initial line of defense. So if something initially starts at the beginning, you're better off dealing with it sooner than later. So they're saying having a real strong relationship with your primary care doctor is the start of it.
Okay.
The second point is that they strongly recommend go get preventive care. Never miss a checkup. Always get your lab work done, even though it might cost you a little bit out of pocket. Do those extra little things that as we get older that we're supposed to do, the colonoscopies, every little thing that you're supposed to do, jump into it and get it done sooner than later, because the sooner you get these done, if there is something there, it's going to be less money
Right, down the
up
road.
front than if you waited a year or two, because it could be a little bit more
Sure.
dangerous, and it could be more evasive, and it could be definitely more
involved,
expensive.
definitely more involved. Yes, good
So
point.
that's like the second thing they're saying. And then the newest things that it's really cool, it's really good, is that they're going to have the webcam where that you can, from the internet, you can visually talk to your doctor. A lot of these insurance companies now will have that benefit starting in April, where that you can have a visual with your doctor to discuss any issues you have right from the kitchen table, which is relieving to a lot of families that have young children.
Wow.
So instead of running into the emergency room if a child has a cough, you'll be able to talk to your doctor, and he will guide you whether or not to come into the emergency room or
Right.
see me Monday morning because
Right.
I think it's just a little cold or whatever the situation is. But having the virtual doctor is going to help lower the cost, because instead of running into the emergency, running into the hospital, you'll be able to talk to the professional to find out what's the best decision for you.
Great, great.
Another real good option is everyone will get an identification card no matter what plan they get. But on the back of your identification card, the 800 number on the card is one of the best lines of care that you can get, because it's 24/7 service. And a lot of the companies starting in April, you'll be able to talk at the very least from the phone, a real nurse. Mm-hmm. And the real nurse will also do the same as the doctor.
Sure.
They'll ask, how are you feeling? What are you feeling? What are you doing now? Do you feel faint? Do you have a headache? All those questions. And then together, she'll help you make the decision. Either stop what you're doing, get in the hospital right now, or we'll make an appointment first thing in the morning, come in and see a doctor.
Okay.
So that's a real good
No,
comfort.
that is a big thing rather
for
than
young
worrying about it,
families.
right? Sure.
Being able to talk to professionals, not just the next door neighbor, what I should do if your child turns blue. There'll be a lot of options.
Okay. Keep going.
And then I wanted the pharmaceutical is going to be a major change.
Okay.
So people, the new things that, like from what your question was from the beginning, or what people should be aware of, is I'm going to point out that you want to make sure that your eyes focus on pharmaceuticals, especially if you're taking prescription drugs. It has changed. So there's going to be 6 different ways
Right.
that you possibly could fit into a particular category depending on the drug you take. Every drug has its own label and how much it costs. Now there's 6 tiers instead of the 2 tiers, generic and brand. It's generic, brand, and then others. Mail order, there's a lot more turning parts in there.
okay.
So just depending on the prescription you have is going to line up with what you're going to be paying.
Right,
But
right.
there's more to it this year than it ever has been.
Okay, well, that's good news. Good news to know about.
There's another thing about on these insurance plans you're going to see more of. It's called co-insurance. And all co-insurance means is that 2 people are paying, the insurance company and the insured. So along with your deductible, you could have on top of a deductible, then co-insurance, meaning, okay, you have a $1,000 deductible, but in the old days we had the 80-20 or the 50-50 up to a certain cap. You're going to be seeing a lot more of that.
Okay,
So there's just more additional out-of-pockets across the board.
okay. Anything else?
And this, we brought it up before, is
Okay.
that you want to keep sharp on what hospital. So what hospital do you want to go to?
Sure.
So we all know that in case of an emergency, you're going to the closest hospital, period. But should you have your choice, you want to make sure you discuss it up front with your doctor, because he's the one that could admit you to the hospital of your choice for a shoulder operation, an ankle operation. An emergency is an emergency. You're going to go in to the
Right,
closest
right.
hospital.
This would be for,
Planned
Right.
operations,
Okay.
that's what you want to talk to your doctor about up front, because not every doctor can admit into Brigham and Women's, Mass General. So it just depends on how you want your care facilitated, is something you should talk about up front. No surprises.
okay. Now, we've talked about a number of different things, and I've related a couple stories that I've had, situations, and I think that I'm not alone. And I think as our listeners are listening to this, they need to sit down and talk to somebody knowledgeable about health insurance and what they can or can't do. And you do provide some services for the chamber as well in terms of programs for the chamber members?
Correct. We've been doing that for over 30 years, where we work with most of the local chambers throughout Massachusetts, where that we don't charge, but someone can call our office or email us and ask questions on just about everything we talked about. What should I be looking for? How come my rates are so
Right.
high? What other options do I have? You know, Blue Cross is not the answer to everybody. I mean, there are still quality companies out there, and the law protects everyone. For example, none of us have to worry about in Massachusetts pre-existing conditions.
Right.
There's no medical questions.
Right.
They have to take you,
They have to take you
no
in.
matter what it is.
Yeah.
So that's relieving. So what it is from there, the laws protect. So it's almost like you want to match up the correct plan with the premium that you can afford.
Right, right.
And
Okay.
if your doctor is solid and you like the relationship, which is the most important thing, you have a good plan. And then you, every 12 months, you can relook at the plan, and it's not where that you have to stay with any particular plan. It goes month to month, so you can cancel any company, any plan, anytime the consumer wanted.
Okay. All right. Well, we're just about out of time, and I know that there's a lot more knowledge you can share with the group, but I've got some contact information for you up on the screen if someone wants to follow up with it further. Okay. I'd like to talk on one other little topic, and that is supplemental insurance. And one of the things that small businesses can't have available to them is what other opportunities can they provide supplemental insurance for their employees? And one of the companies that does that is Aflac. And basically what it does is it doesn't cost the employer, but the employee can pick up that cost themselves to get additional coverage on different things.
Yes. So we have a bunch of plans like that. The plans where that, like you said, that could kick in if you get disabled. We can provide an income. Or some plans are just a pure accident plan where that we provide income to that person, and they would offset a day's worth of work if they missed work.
Okay.
We also have dental plans because sometimes companies like to add the employee benefits.
Sure.
So dental seems to be popular also, and long-term care is becoming pretty popular
Pretty
also.
popular, yeah.
And then there's group life insurance on a reduced cost. So it's just part of the benefit package that the employer is looking for to present to the employees?
Okay. Well, as I said, we're just about out of time, and I wanted to cover on a couple things. John, first off, I'd like to really thank you for coming in today.
Thank you very much
and
for having me. Appreciate it.
Glad to be on the show. We have a program in Beverly that we call Keep It Local. It's hashtag Keep It Local, and what the purpose of that program is to encourage people to buy in the local area as opposed to Amazon. And although you can pick up stuff from Amazon here, I think in Beverly somewhere. But
Well, if you recently heard that Amazon is going to be trying to get into the health insurance business,
yes,
I heard that. So that's going to be fascinating to see how that unfolds.
It's like an octopus, but
Yeah.
yes. So, I mean, I think that's important. Keep it local, keep the local businesses going. That's very important. And if you have any comments or questions or topics for Father that you'd like to have on the show, please email me and I'll be happy to consider them. And again, John's contact information there. If you have some questions, I think the takeaway from this session is you need to talk to an insurance professional so that you understand what your options are and you can make this work. Thank you very much for listening to The Voice of Business today.